I'm a former Major League Baseball physical therapist that helps injured pitchers get back on the mound. And I'm going to go over with you today several eccentric rotator cuff strengthening exercises I will use for pitchers as part of their return to play process coming back from an arm injury or as part of their arm care program. So first off, why do we want to train the rotator cuff eccentric? We look at what the rotator cuff does. It does a couple different things with throwing motion. It helps stabilize the shoulder within the joints. You're getting nice smooth rotation, not getting a lot of pressure on other different structures, such as bicep tendon, cuff tendon, or versa. And what it also does as well is it helps to decelerate the arm, specifically in that deceleration follow through phase. It quite literally helps prevent the shoulder getting pulled out of the socket as you're getting through on that deceleration follow through phase. So now, knowing that, what we want to do is we want to train the ability for that cuff to decelerate the arm eccentrically. So there's a couple different ways that we'll start this drill. And the first thing we're going to do is an eccentric T or horizontal abduction. So what we're going to do, you take a band here like so. You are going to use essentially your inside hand to help put your arm out to that position. So what I'll say here is when we're doing any of these drills, you want to make sure you're using enough of a resistance where you really can, for multiple reps, go out on your own. So it should be something you have to essentially get some help with. So you're going to take your hand on the inside here, you're going to pull out to the side here, and then it's going to be a slow 1, 2, 3, 4, 5 back across your body. So again, it's going to look like I'm going to step out here, look for more resistance. You're going to pull out, get to that position, slow 1, 2, 3, 4, 5. So again, it should be enough resistance where you really have to fight it pulling you. It shouldn't be enough where it just kind of rapidly pulls you in like that. And it shouldn't be so easy where you can hold it for like 10 to 15 seconds to come back in. So that's the first one there, is that eccentric T of horizontal abduction. The next one's going to be an eccentric 90-90 ER. So for this one, you're going to be in your split stance here, arms up in that 90-90. You're literally going to take that band, you're going to put it up to 90-90, and then from here it's going to be a slow derotating 3, 4, 5. I'm going to back up a little bit here. You're going to pull it up. It's going to be a slow 3, 4, 5. The biggest thing is as you derotate, you don't want to let that shoulder kind of pop forward like that. You want to keep everything in a good smooth rotation. Then the last one is going to be a T. So for this one, I'm going to drop it down a little bit more. And what I'm going to do is it's going to be a lot more of a diagonal path. Okay, so for this one, I'm going to literally pull it up, and then you'll see I kind of play around the handle here. I'm going to bring it up to this overhead position here, and then it's slow down across the body like so. So I'm going to have to step out more a little bit. And you can even bring it a little bit lower here on this setup, possibly even like to the bottom of the squat rack. It would probably work better. But for this, again, you're going to come up to that 90-90 position here, or excuse me, you're going to come up to that overhead Y position, and then it's a slow come back down across your body. So you can see I'm starting to thumb up, and then I'm coming back down with my thumb in. So again, it's going to look like that, coming out here, and then coming down. Now, if you don't have somewhere to put it down low, what you can do, you can just step on the band. So what that's going to look like, take that off, you're going to step on the band, you're going to go from here, you're going to pull up to that position up top overhead, and it's a slow 1, 2, 3, coming down across your body, down towards that hip. So you can see why it's like, you can get it done a little bit if it's almost at like knee height, but really for the best effect, it's going to be to have it down towards the ground, whether it's on a low cable comp or if you just step on a band, you know, something to hook it onto, that's also fine. So again, I'm up here, and it's a slow 2, 3, 4, 5 coming down. So again, those are 3 eccentric drills. Now, we're looking at exercise prescription. How much do you do? If you've never done eccentric before, it's not uncommon to get sore from them because it's a much more strenuous muscle contraction. So I'll typically start on the much lower side, where it's maybe 1 to 2 sets of just 4, maybe 6 reps altogether for when we're starting these off. And then eventually we'll progress to the point where it's okay, we're maybe doing 2 sets of 6 to 8. It really just kind of depends on where each individual and each athlete is in their either rehab process or exposure to eccentrics. You want to be mindful when you're doing these. So like for guys that are not injured, I always say have your eccentrics be after your high days, whether it's after you go out and pitch or have a high bullpen, have that be your eccentrics. What you don't want to do, you don't want to do a lot of eccentrics the day right before you have a high day like pitching, and certainly not the day after, because then it's going to not allow you to recover for that high day, or it's going to impede your recovery for the next day. So give these 3 exercises a try, and based on those recommendations in terms of when you should implement them, and from an exercise prescription set and rep standpoint. If you have any questions on them, leave them below in the comment section. Subscribe to our channel